Welcome to today's lecture on medical microbiology. In this session, we will be discussing the important topic of specimen collection and processing. This is a crucial aspect of laboratory diagnostics, as it directly impacts the accuracy and reliability of test results. We will explore various techniques, procedures, and considerations necessary for ensuring the proper handling and analysis of clinical specimens. When obtaining specimens, it is paramount to maintain aseptic conditions to prevent contamination. Healthcare professionals must follow strict sterile techniques, such as proper hand hygiene, the use of personal protective equipment, and the disinfection of the collection site. Additionally, the collection tools and containers should be sterile to avoid introducing unwanted microorganisms into the sample. Clinical specimens come in various forms, including blood, urine, sputum, cerebrospinal fluid, stool, and genital samples. Each specimen type provides valuable information regarding different diseases and infections. For instance, blood specimens aid in the identification of systemic infections, while urine tests help diagnose urinary tract infections. Understanding the significance and characteristics of each specimen type is crucial for accurate diagnosis and selection of appropriate laboratory tests. To ensure proper tracking and identification of specimens, it is vital to appropriately label each sample with the patient's information, specimen type, and collection date. Adequate labeling reduces the chances of sample mix-ups and facilitates efficient analysis. Furthermore, timely transportation of specimens to the laboratory is essential to maintain sample integrity and prevent degradation, especially for delicate samples like blood or microbiological cultures. In certain situations, specimens may need to be stored for a period before analysis. Proper storage techniques ensure the viability and integrity of the sample during this time. Refrigeration, freezing, or the addition of preservatives are commonly employed methods to maintain the specimen's stability. These techniques vary depending on the specimen type and the test to be performed, and they play a critical role in preserving the analytes of interest. Molecular diagnostic techniques, such as PCR and sequencing, require specific handling procedures to prevent cross-contamination and ensure accurate results. It is essential to avoid the introduction of extraneous nucleic acids during specimen collection and processing. Utilizing dedicated equipment and following rigorous protocols, including DNA and RNA extraction methods, minimizes the risk of false positive or false negative results in molecular assays. Blood cultures are vital in diagnosing bloodstream infections. Proper collection techniques, emphasizing sterility, are necessary to avoid contamination. Aseptic venipuncture and the correct selection of culture bottles are critical steps. Furthermore, the appropriate quantity of blood sample, the use of anticoagulants, and the incubation conditions play a crucial role in maximizing the organism recovery rate from blood cultures. To accurately diagnose respiratory infections, it is imperative to collect quality respiratory specimens. Techniques include sputum induction, deep cough specimens, oropharyngeal swabs, and nasopharyngeal swabs. Each method has its advantages and limitations and should be selected according to the suspected pathogens and the patient's condition. Appropriate transport media and timely processing are essential to preserve the viability of respiratory pathogens for accurate analysis. Urine specimen collection requires attention to detail to avoid contamination and ensure reliable results. Clean catch midstream urine samples are preferred to minimize external bacterial contamination. Proper collection containers and instructions to patients for attaining an uncontaminated sample are critical. Moreover, urine specimens should be processed promptly and, if necessary, refrigerated to maintain the integrity of any potential pathogens or biological markers. Stool specimens are analyzed to identify gastrointestinal infections, including bacterial, viral, and parasitic causes. Proper collection techniques involve avoiding contamination by urine or water and collecting a sufficient quantity for analysis. Stool specimens may require immediate processing or, in the case of certain parasites tests, fixation or concentration using specific protocols. Adhering to these procedures enhances the sensitivity and accuracy of laboratory tests. Collection methods for genital specimens vary depending on the suspected infection and sex of the patient. Swabs, urine, or semen samples may be collected for the detection of sexually transmitted infections. Following specific collection and handling protocols, such as using appropriate transport media, ensures the preservation of pathogens' viability. Proper labeling and documentation of information related to sexual exposure or symptoms are also crucial. Cerebrospinal fluid, CSF, is obtained through a lumbar puncture and is critical for diagnosing central nervous system infections. Strict aseptic techniques are necessary to minimize the risk of introducing contaminants into this sterile sample. Proper sample collection, handling, and preservation protocols, as well as prompt and careful transportation to the laboratory, are crucial to preserving the integrity of the CSF and maximizing diagnostic yield. Viral cultures play an essential role in diagnosing viral infections. Proper processing and inoculation techniques are employed to promote viral growth and isolate the infecting virus. The selection of appropriate cell lines, culture media, and incubation conditions are critical factors. Careful monitoring during incubation and identification of cytopathic effects contribute to successful viral isolation. Proper specimen collection and processing are vital for accurate infectious disease diagnosis. Adhering to sterile techniques, appropriate labeling, transportation, and handling protocols are crucial for reliable test results and effective patient care.